Hello, my name is Muruch Kadum, and today we're going to be talking about the four telehealth interconnected parts and their connection between. Okay, so we're gonna start out with what are those four sides? Those four sides are business, technology, and healthcare and policy. For the for a telehealth program to be successful, all those perspectives are to build a successful telehealth program. Next thing we're going to talk about is healthcare perspective. And telehealth is important from the perspective of the provider since it may allow things like online meetings, education programs, and long distance medical health care. Telehealth is also has benefits for the patient since it allows accessibility to medical services at any time and from any location thanks to the technology. Now, the policy perspective, there is a connection between the healthcare and the policy perspectives. Hospitals and medical clinics in the United States were given new flexibilities during the COVID 19 public health emergency, which led to a growth in the offering of telehealth services. Telehealth was not often used before this because the organizations governing it were so strict. Alrighty, next we're going to be talking about the HABA policy. The guideline states that the telehealth services must only be provided in private settings and that the PHI must also be protected from unauthorized use. The policy provides an agreement between protecting the privacy of patients, care, and recovery, and not allowing for important uses of information outside. These are the three rules. The policy rule is important, the security rule is important, and also the notification rule. The technology perspective through the laws like HIPAA, which provide important patient security. The privacy perspective also connects the gap between the healthcare and the technology perspectives. So the three types of HIPAA safeguards, meaning in it is, for example, the risk assessment, assessing a privacy, hospital staff training, and the next is the physical, which means examples alarm systems, security systems, locking areas where PHI is stored. Technical, for example, data, end to end data like that, and any viruses that the software can, any automatic log off like that, auto connections like that. Providers that want to continue providing telehealth across in the future may have a big focus on technology used to deliver those services and to follow the past PHIE policy of using audio only telehealth. Even through the Congress is still attempting to attempt those telehealth options to make it more better. Alrighty, so the technology and the impact in telehealth is very big. The impact that technology made in telehealth was the ongoing development. For example, like the AI intelligence is always used in healthcare. Services like apps, doctor visits, and clinics. AI is being used in healthcare in a variety of ways to ensure that medical services and practices are being able to be delivered high quality treatment. There is a lot of AI intelligence that's being used. AI healthcare is only getting started, and I think it's probably going to be a big, greater impact on improving the volume and the availability of healthcare services. And medical training programs are being more realistic, engaging because of the role of healthcare in information technology. It's been known as one of the most techniques in the treatment of some of the illnesses. That next, we're going to be talking about the business perspective. Okay, so it takes planning, research, and knowledge for requirements of the community to begin a successful telehealth program for patients with diseases. A committed team with each member understanding their position, their duty is important for a successful and in any telehealth program. The regular testing and monitoring are necessary for many severe diseases in order to maintain for the patient's health and well-being. That's Okay, so that's when we have a business plan created. In order to create your new telehealth program, you might need to reorganize or hire some staffs to begin and continue your telehealth program successfully, and must use all the effective technology and newer technology that may be used. So successful telehealth business is telehealth finance that may provide insight onto an improvement that creates to provide the multiple seekers of telehealth projects, program businesses with a focus on providing excellent patient care using that technology. The design and version of a successful telehealth business model are not just a telehealth healthcare service, but a regular new organization, significant financial and leadership.